Hi everyone, my name is Rosaran. I have completed my master's degree in forensic psychology from National Forensic Sciences University, India. Now, I'm going to talk about assessment, treatment, and consultation in forensic psychology. So, from previous videos, I have talked about introduction to forensic psychology, but in this section, I will talk closer to the major areas involved in practice of forensic psychology. Forensic practice can be divided into three specific areas: assessment, treatment, and consultation. The first two areas are not unique to forensic psychology, but are central to the practice of clinical psychology. They therefore may be somewhat familiar to you if you have had a course in abnormal psychology or clinical psychology. Forensic assessment normally consists of the evaluation of an individual in an attempt to assist the court in addressing a legal question. And at the end, as a result, there are a number of ethical considerations that are somewhat unique to a forensic assessment. Forensic assessment relies on similar methods and tools as the general therapeutic assessment, but also use some forensic specific methods. In discussing psychological treatment in a forensic context, we will largely focus on criminal offenders, mentally ill or not, and aspects of treatment that are especially relevant. Consultation is something that is more likely to occur in forensic practice than routine clinical practice, and therefore may be unfamiliar to most students who are studying forensic psychology. So, it makes consultation often ignored but extremely important role for forensic psychologists, who frequently assist attorneys or the courts themselves in understanding aspects of human behavior and mental health that do not directly involve the assessment or treatment of individuals. Nevertheless, the consulting forensic psychologist is engaged in crucial aspects of forensic practice that may be growing in scope and frequently by Andrews in 2005. Now, uh, in this part, I only want to talk about forensic assessment. When discussing assessment from a clinical psychology perspective, such as a therapeutic assessment, the focus is on gathering information about and examining to make a diagnosis or conclusion about his or her current psychological function. When a client walks into a psychologist's office, an emergency room, or a psychiatric hospital, he or she may be subjected uh, to a psychological interview or given a psychological test. But in forensic assessment, the focus is not only on gathering information that allow the forensic psychologist to make a conclusion about the examinee's mental health, but to do so in order to inform the court. Actually, we can see the same methods that clinical psychologists use in assess anyone presenting with a mental health concern consists of interviewing, psychological testing, and gathering civil and third-party information. The difference is that in a forensic context, these methods take on added importance because they have far-ranging implications beyond an accurate diagnosis and may extend to the person's freedom or the well-being of society. A therapeutic assessment is designed to diagnose an individual so that an intervention can be developed and the person's suffering reduced. However, in forensic assessment is different from a traditional therapeutic assessment because there are two additional tasks involved in forensic assessment. Forensic assessments must clarify and identify the legal question and assess whether forensic psychology has something to offer in a specific situation. So I will explain more clearly now. In forensic psychological assessment helps the investigating agency to identify the deceptive person to exclude the innocent from the list of the suspects through non-invasive analysis of verbal, nonverbal, behavioral, and psychological cues. Forensic psychological assessment is a novel forensic aid to investigation through which the investigation officer can get valuable assistance in determining and truthfulness of the statement of the subject. Neither the Supreme Court nor NHRC or Komnas HAM in Indonesia's guidelines restrict the applicability and utility of the forensic psychology assessment. Permission from the court is not required to conduct this test. The investigation officer has to make himself available before the forensic psychologist along with the suspects or witnesses or victims or complainants whose statements need to be analyzed. One-to-one interaction with the forensic psychologist is essential for this assessment. It is purely a non-invasive technique. The forensic psychologist will conduct appropriate psychological, behavioral, uh, psychological tests, interview, and offer his opinion based on the verbal, nonverbal, and behavioral analysis of the subject. Of the subject. It is time-consuming as it involves paper-pencil tests, answering some hypothetical questions, projective questions, and no physical contact. Forensic psychological assessment is a psychological technique that aims to aid investigators to generate new leads and narrow down a pool of suspects to identify the most likely offenders. Now, after I have explained before, uh, it is important to review two important concepts that are central to assessment, specifically psychological testing. Reliability and validity are terms that can describe uh, the measurement or psychometric soundness of a given test or producer uh, procedure. Reliability generally refers to the consistency of measurement. For example, someone who suffers from depression should obtain a similar score across multiple administrations of the psychological test designed to assess the patient. If a person is tested from a week to week and her symptoms do not change, her score should be similar each week. If a depressed person's scores varied widely with repeated administration of the measure, while his or her symptoms remain largely unchanged, it would suggest poor reliability for the measure. On the other hand, validity is the accuracy of measurement. In order for the BDI tool to be valid, it needs to measure depression and not something else. A measure of depression should not affect something like the amount of physical exercise one experience or something unrelated, such as the frequency of watching television show like American Idol and or Indonesian Idol. Higher levels of both reliability and validity suggest that a procedure or test is sound enough to be used. Reliability and validity are generally expressed by correlation that range from -1 to 1, with higher correlation indicating better reliability and better validity. One aspect of reliability and validity that is often an issue in forensic assessment is that general clinical procedures and tests are frequently adapted for use in forensic contexts without the reliability and validity being properly determined via scientific research. Now, uh, I will explain or I will talk about the difference between forensic assessment and therapeutic assessment. Um, so we can see the purpose forensic assessment and purpose of therapeutic assessment. In forensic assessment, uh, first is helping legal decision makers. Examiner and examinee relationship, objective or quasi-objective roles. Standard, standards, clinical and legal standards. Source information, uh, clinical, psychological, and collateral information. Clarification of reasoning and the limits of knowledge is expectation to be challenged. Documentation and communication of results is evaluation reports tend to be lengthy and detailed. Verbal communication about the evaluation results is high expectation to testify as an expert witness. Assessment base is psychometric consideration, normative data, reliability, validity, and sensitivity. However, in therapeutic assessment is diagnosis and treatment. Examiner and examinee relationship is helping role. Standard is clinical standards. Source of information is clinical and psychological information. Clarification of reasoning and limits on knowledge is no expectation to be challenged. Documentation and communication of results is no identified expectation about the structure, format, level of detail, and context of the evaluation report. Verbal communication about the evaluation results is no expectation to testify as an expert witness. Assessment based uh, is vertical orientation assessment approach of the practitioner. So that is the difference between forensic assessment and therapeutic assessment. So this is uh, the explanation about forensic assessment. And the next video, I will continue to explain about this. I promise to declare the truth. Bye bye.